Hello friends. Today I'm going to talk about children and adolescents psychosocial care issues during COVID-19 pandemic. I'm Dr. Mythili Hazarika, an associate professor of clinical psychology from Guwahati Medical College. I'm involved in a lot of organizations in the state. The discussions generated during the presentation are academic in nature. They are not the laws nor are they substitutes for any kind of professional or legal opinion. For any legal opinion, please contact a lawyer or an advocate. What are the issues the children has during this pandemic? The children are developing, their minds are developing. So it is a transition time from child to adolescent to adulthood. So the peer knowledge is influencing them, and they will be always thinking about what is happening, what is going on around them, why are the schools closed, why is this lockdown happening. So many things will be creating a lot of thoughts in their mind, and they will be always very curious. They have high physical energy, so they need to spend a lot of time outdoors. So high need for social play is also there. So these are the issues that they are not being able to meet during this lockdown period. So there are risks of infection because of which they have to be inside. Anxiety and excessive fear of illness in the parents prohibits the children to go out. There is a disruption of normal routines because the structured routine that they otherwise follow is completely disrupted now. The parents are worried about the loved ones, the children are worried about their friends, and there could be diminished care and supervision because a lot of stimulations will be lacking at this point of time. So the care and the supervision also may come down. So there are a lot of issues that is bothering the parents as well as the children at this point of time. What are the stress signs in children? In the preschoolers, the stress signs could be thumb sucking, bedwetting, clinging to parents, which they never used to do. There could be sleep disturbances. There could be loss of appetite, not being able to eat well. There's a fear of dark, and they might also regress, to early childhood or baby behavior if they kind of show symptoms like a baby, like an infant, or they can withdraw. In the elementary school level, there could be irritability, aggressiveness, clinginess again, which was never there with their parents, poor concentration on studies. They could also avoid engaging with friends in any of the social networking or engage in activities also will come down. In adolescence, there could be sleeping and eating disturbances, agitation. They could be tearful. They may withdraw themselves completely. They could be in fights, in conflicts. There could be physical complaints. There could be loss of interest, poor concentration. These are the different variety of problems in different age group. But if these symptoms persist for more than 2 weeks, then they need treatment and care from mental health professionals. We need to be very, very aware of the children's behavior and emotional status at this point of time. They do not express, that doesn't mean that they don't feel. So you need to find out as adults what is happening to them. Talk about the risk of infection. How? With appropriate language, talk to children in calm and assured manner. Introduce COVID-19 as a kind of flu or a germ. That give the germ theory, how the germ gets inside and you get a disease for different kind of problems like any kind of fever, cold, how we get sometimes when we are in the rain or we are not taking care of ourselves, when we are feeling too cold. So these are the factors that we need to introduce. So our immune system gets compromised in certain ways and we get infected. Do not scare them with literary facts, and to younger ones mostly, but with adolescents and all, you definitely can say about the disease process and the transmission. Correct information should be given, no misinformation and no magnification. Do not magnify issues. Do not make it very big. Try to normalize it. What about the risks of infection? You need to talk about hand washing, that is 20 seconds, using probably a song as a reminder to think about the song and go for washing your hands for 20 seconds. Show how to wash the hands. There is a particular method of washing hands so that it is completely hygienic. Physical distancing should be imposed upon them, and also to be told about the transmission that happens with contact. So if they are not physically in contact with people around them, with elderlies also, they will have less infection. So regularly disinfecting surfaces and objects by the school and homes are also some of the techniques that has to be ascertained. What are the model basic hygiene and healthy lifestyle practices? Help children simply understand the basic concepts of the disease prevention, like how germs can spread, for example, by putting colored water in a spray bottle, spraying over a piece of white paper. Observe how the droplets can travel so fast and make the white paper the other color that you have dropped, the ink or anything else. So you can then tell that this is how the germs spread. It is just fraction of a second. Demonstrate why it is important to wash hands for 20 seconds with soap and water. Put a small amount of glitter in students' hands and have them wash them with just water. Then it will not get washed well. Then again you ask them to wash with soap and water, then it will get erased. So show them how it happens, and that this germ is very, very aggressive. So it will stay if you don't wash your hands well. Have students analyze the situation to identify high-risk behavior and suggest a modifying behavior. What are the high-risk behavior? Like if you're sneezing, you have to keep your elbow while you sneeze, to show them the technique of sneezing onto the elbow like this, and how they should use their mask over and over again, and not to sneeze and not to go near people who are coughing, who have some allergies. So these are the certain techniques we have to tell the students. Do not share cups, utensils with anyone, food or drinks with other people, because the virus gets transmitted by droplets, so oral droplets, so should not do that. Focus on good healthy behavior such as covering cough, sneezes with the elbow and washing hands, which I've already said. So keep explanations age appropriate. So for elementary school people, the children, you use very brief and simple information. Do not make it very big. Reassure that adults are there to help them keep them healthy, and also to take care of them if they are sick. Give some examples of the steps people are already making, and also to stay healthy. Use language such as adults are working hard to keep you safe. So reassure them all the time and reinforce positively about their hand washing behavior, about keeping themselves away from elderly. That needs to be reinforced to them again and again. Upper elementary and early middle school children, they are more vocal, more verbal in asking questions about anything and everything about COVID. So you need to lighten their curiosity, reduce their curiosity with basic facts, and that research is still on, so you cannot conclude about the facts yet. They may need assistance separating reality from myth and rumor and fantasy, because young children fantasize and they sometimes negatively magnify things. So you need to give assistance to separate that from fantasy and rumor. Discuss their concerns and normalize if they are magnifying issues and becoming very fearful. Normalize situation, do not make it big. As it is, people are all fearful, and discussions about COVID is making everyone insecure. So do not do that in front of the children. Keep discussions less at household and only keep some time about COVID-related discussions, not more. Discuss the efforts national, state, and community leaders' effort in preventing germs from spreading. Upper, middle, and high school students, issues can be discussed in more depth. Elaborate discussions with consensus. Refer them to appropriate sources of COVID-19 facts, appropriate sites. Provide honest, accurate, and factual information about the current status of COVID to them. Engage them in decision-making, sometimes about family plans, who would do what, delegate responsibilities. They should also be involved in the plan, in scheduling the chores at home. Delegate responsibilities only with their feedback. Do not impose things upon them. Children do not like being imposed and forced. So do things with consensus, with a discussion model. For all children, encourage them to verbalize their thoughts and feelings and be a very good listener. How to deal with anxiety and fear. Help to express feelings. Parents can initiate by talking to the child. Normalize the feeling, look for any emotional cues and talk regarding the same. If they're withdrawn, talk about it. Are you feeling withdrawn? Are you feeling fearful? Just talk about that. Acknowledge and show understanding of the child's concern. Avoid being judgmental when the child is expressing. Don't say, no, this is wrong, that is wrong. No, just validate it and then give facts. Teach relaxation, abdominal breathing, deep breathing exercises. Do yoga with them together. Coach to practice positive self-talk and change inner belief system. If there are belief systems which are wrong, which is erroneous, you have to clarify those and make them practice positive belief systems. Ensure adequate daytime rest and nighttime sleep. Sleep deprivation should be avoided in children. So you need to impose that everyone should sleep at a one particular time and get up at one particular time. Schedule the sleep time, which is very important, in a very unstructured routine. Regularly revise the fact. Dealing with worries about loved ones, psychological availability of parents should be told to them. Some discussion about favorite memory, discussing about events, old family album you can take out, relive those memories. Engage children creatively in responsible chores, which I've already mentioned, like washing dishes, baking, cleaning together. Parents can role model children to make a list of all things they wanted to do before, doing some fun things together, things maybe you have never done with your children before. You can try doing them, helping to connect them to loved ones, to write a letter to them. Letters, people nowadays, they do not write with their own handwriting, so probably you can start doing that. Practice some gratitude exercise, like make a list of things, people, places you feel grateful about. Place a jar with different activities in front of them. They will write the activities in sheets of paper and keep them in the jar, and they take one by one and do those activities. Whatever they pick it up, it's their choice and they have to do it, something like that. Restore the child's routine. Make a routine of learning at home. Encourage the habit by setting adequate time for learning every day, giving short assignments to them related to lessons they have learned, and check the progress. Also, give stars, give positive reinforcement to them. Update school's information by connecting to school staff and friends. You need to encourage them to keep in contact with the school teachers, friends. Locate the learning resources to update oneself academically, what is in the academics, to update them with time. Arrange for online tutors if it is possible. Restrict the TV time by setting some limits, some hours for TV time. Cut down screen time for less than 2 hours per day. All of you should do that. Adults also should do that. Encourage indoor play, recreational and physical activity indoors, and parents can join in all those play activities. Probably they had no time before to do all those, and they can practice that. Try some kind of picnics in the open spaces of the houses, like the veranda. Everybody does their part and create some kind of food items and choose from the menu, and then try it out and cook it, prepare it well, and eat it together. So appreciate efforts to follow all these different kind of activities that I have said. Ensure social contacts and via virtual media only. Inculcate hope in order to that things will be fine. Modeling behavior, talk about positive stuff, and there are child helpline numbers 1098. If there is an emergency, then you can definitely call up 1098. Or if there are other issues related to COVID and other anxiety issues, then you can call up the telepsychological counselors here, that we are all ready to help you out. The take-home message is, this is a temporary phase and not long-lasting. You need to ensure and tell the children about it. This too shall pass, but only when we act responsibly and collaboratively. But in togetherness, we can address and we can fight COVID. First priority is physical safety. Second priority is restoring to normalcy and quality in daily routine. These needs to be inculcated strongly in children and in us. If we believe these, then the children also believe from us. So we need to give positive messages to our children to keep them mentally healthy at this time of crisis. Thank you very much. These are my references. Acknowledgement to Ms. Sandamita Chaudhary for her input. Thank you very much. I hope it gives you some feedback and some resources to guide the children when they are in crisis, and also the parents to handle these children when they are showing some kind of stress signs and anxiety symptoms or any other mental health issues. Be safe, be healthy. Thank you.